This broadcast is brought to you by Colby Brooks with Century 21 Right Pace Real Estate and buyfrombrooks.com. Let Colby Brooks handle all of your real estate needs. Well, a number of headlines breaking in the past 24 hours, so we're going to catch you up to date with the news early this morning on NEA Report. The big headline we're going to be talking about coming up, Jonesboro is going to be under a curfew beginning tonight, 10 p.m. till 6 a.m. until further notice due to COVID-19. There's a lot of exceptions for this, and there are reasons for this too we'll be talking about, all next on NEA Report.
Stan Morris reporting.
Good morning, everyone. A lot of news happening in the past 24 hours, especially in the past 12. So let's get you caught up on everything that's happening today as your Friday is beginning. Starting with numbers of COVID-19 cases in Arkansas up to 1,146. With 305 recoveries, we're going to start bringing you another number. We want to talk about the active patients that exist right now. And the math is simple. That's the cases subtracting the recoveries, which means 841 active patients are in Arkansas right now. The sad number is that 21 people have died in Arkansas. And of course, these numbers are representative out of 15,702 who have been tested. Of course, 14,000 of those plus coming back negative. In Craighead County, where we're going to be talking about the curfew here shortly for Jonesboro, 28 positive cases have been reported, with 12 recoveries so far. 236 negative tests have been taken for Craighead County, and I should say processed, by the way, because probably a lot more than that have been taken. We keep getting reports from medical professionals saying we're taking hundreds more tests ourselves, and that may be true, but they've not been processed yet. And at least they haven't been processed on the Department of Health's website yet. Once that happens, things change officially, and we can report it, right? In Poinsett County, 6 positives, 4 recoveries, 27 negative tests. Those are the latest numbers from the Department of Health as of this morning. In Randolph County, 7 positive cases, the number trickling up. 4 recoveries, though, that's good, and 127 negative tests having been performed so far. In Clay County, only 1 positive case so far confirmed by test, 42 negatives. Of course, 0 recoveries, but it's barely there. In Lawrence County, there have been 9 positive cases. According to the Department of Health, there's been 1 death. There's also been 1 recovery, and 87 negative tests taken in the county. In Sharp County, 2 positive tests, 4 recoveries, 15 negative tests processed. In Mississippi County, the numbers are, as of the latest update, 6 positives, 3 recoveries, and 60 negatives. Finally, Crittenden County, which we're talking about because they've seen a spike that's continued to grow. 77 positives, 8 recoveries out of that, only 8. And 2 deaths, 400 negative tests. They are testing a lot more, but again, they're next to Shelby County where things have been pretty bad. Memphis, we're talking about. In other counties, just to mention, Jackson and Fulton County still at 0. Independence County up to 5. In White County, 27. Cross, 6. Izard County getting on the map with 1. Confirmed cases in the United States as of this morning, 466,000 with about 16,600 deaths. 26,000 have recovered. Across the globe, the numbers this morning, 1.6 million, with 95,000 having died of COVID-19 or COVID-19 related symptoms. 355,000, actually just about 356,000 have recovered. Well, the big news coming over the past 12 hours, or 24 hours, I guess we would say, just to be precise, is that the Jonesboro curfew is going to go into effect tonight. We're talking about Friday night for those that may not be watching on the day that we broadcast this, but it's Friday night, April the 10th, 2020. And we've seen a curfew already in the aftermath of this tornado devastation that happened almost a couple of weeks ago now. But as of this evening, the Jonesboro mayor is implementing a COVID-19 emergency curfew. Let's go through the basics of it to let you know what's going to happen and who it does and does not apply to, right? Because if you're going to work, if you've got to go to the hospital, if you're traveling, you're fine. This doesn't apply to you. We'll tell you who this is really aimed at here in a second, but first let's tell you the basics. 10 p.m. to 6 a.m. nightly. Jonesboro Mayor Harold Perrin got the approval of the governor, Asa Hutchinson, and issued the nighttime curfew. It was on Thursday evening that he announced it. It's part of Jonesboro's effort to reduce the impact of COVID-19, according to the press release. It's a declaration of local emergency, and it starts, as we've said a couple of times, tonight. Runs until 6 a.m. Each night, and it's going to go for no more than 120 days. It's going to be reviewed by the Jonesboro City Council at the next meeting, which is on April 21st. And the mayor says he hopes the curfew is not needed for the full period of the declaration, meaning the full 120 days. The decision, according to the mayor, is the result of a confluence of factors that indicate such curfews can be successful in helping reduce the spike in cases of the coronavirus in communities. We talked about Craighead County's numbers, the latest numbers that was actually released, I believe, after this was implemented. I'll show them one more time because I just want you to see them. 28 positive, 12 recoveries, 236 negative. The positives have continued to trickle up, but not necessarily out of control, and we're seeing recoveries happen at the same time. Jonesboro, however, has not hit its peak. That's what the medical experts are saying. City Medical Director Dr. Shane Spites and Dr. Greg Bledsoe, Surgeon General for the state of Arkansas, were also consulted in the decision. Dr. Spites said that cases go up every day in the state and across the area. He said the community's duty is to keep working to flatten the curve. Quote, "It is our duty to continue to look for ways to reduce the impact of this disease on our local healthcare workers, hospitals, and the general public." And we'll talk about that more here in a second. He said everyone has to understand how easy this thing is transmitted. 25% of carriers show no symptoms, and the apex of cases in Jonesboro is not predicted for another month or so. Right? So these are all reasons why that this is going into effect. And I say that because a lot of people are saying, well, it's not even that bad right now. And of course, those people are accurate in certain senses for here so far. But a lot of the reason why this has slowed or appears to have perhaps slowed in the growth is because of the efforts that have been taken so far. And more efforts being taken will possibly slow it even more. Of course, the debate is always up to the viewer or the listener, however you want to see it, as to if they agree. But there are reasons behind this, scientific and medical reasons that are behind this, and those are explained pretty clearly in this press release and have been by our city leaders too. Now, we said this already. Activities that are not going to be impacted by the curfew include travel to and from work. If you got to go to work at 4 a.m. or midnight or whatever, you're fine. If you get pulled over, you tell the officer that. They're going to be fine. They're going to be nice to you about it. I mean, these are sworn constitutional officers who, I guarantee you, take this stuff very seriously. And they're looking at this more carefully than anyone, being people that want to protect your constitutional rights. That's their duty. So whatever you tell them, you have a legitimate reason for being out, such as going to work or a medical reason, contacting emergency services, obviously, like firefighters or ambulance or law enforcement, or if you're traveling, then you're okay. Those are the things: travel, emergency services, medical reasons, or work. Here's the main thing that this is targeting. If you're going to a 20 or 30 car party at a neighborhood where, everybody knows there's a party happening, then not going to be allowed. If you're going to the liquor store in the middle of the night, probably not going to be allowed. There's stuff that they're making this clearly targeting for. And those are your freedoms. And yes, you should be able to do those things, whether anybody agrees with them or not, in general, everyday society. But right now, in the sense of an outbreak, a pandemic across the globe, it's I guess it's up to the eye of the beholder, but the medical experts say cutting this stuff out is important to saving lives and stopping this thing from peaking. Now, it is going much higher in the United States, the death count. The startling number that I got to see as I was getting the numbers together this morning was the death count had risen to almost 17,000 in the United States. Very hard to see those numbers, right? I mean, that's bad. But it would be significantly worse with this being far more contagious than just the standard flu and far more deadly than just the standard flu if actions had not been taken. Those actions seem to have been necessary. I mean, if there's evidence at some point that they're not, we'll talk about that. And if we're wrong about that, then we'll talk about that too. It's better to be safe and wrong than unsafe and wrong. And so when you're seeing the numbers of deaths continue to climb, I'll just talk about them by state for a second, if I may, because right now confirmed cases in New York, 161,000 more people in New York have it than any other country except the United States. 7,000 deaths so far in New York. In New Jersey, 1,700 deaths with 51,000 confirmed cases. In Michigan, 21,000 plus cases, but over 1,000 deaths. There's a lot of an older population perhaps there that might be affected. California, 20,000 confirmed cases, 500 deaths. And of course, Arkansas, we've talked about where we're at here. We're much further down the list. If you look for confirmed cases, Arkansas's, you have to scroll to the bottom third basically to find Arkansas. And we have almost, you don't want to say no deaths because there are 21 deaths. That's 21 more people than we wish would have passed, obviously. But compared to other states, our numbers are not there yet. And so a lot of people are not as comfortable with some of these decisions, and I understand that. But whenever we're looking at our communities that are 2 to 4 weeks further along in this than we are, decisions have to be made to prevent us from seeing as bad of a situation as they have. So I want to show you some graphs now that have been made and basically put this into perspective in an longtime friend and supporter of NEA Report, Dr. Patrick Carroll in Pocahontas has been making several very informative graphs daily that show the progression of the coronavirus in Arkansas. And these are important because, as we mentioned, rising numbers, it sometimes doesn't necessarily translate for people that remember the number the day before and they're not understanding how much or how little it's growing. So you can see the number of cumulative cases is growing in Arkansas, and that's pretty much a given, right? We know that, and we see that every day in the numbers. You can see how far or how steep they're growing with the actual line, which shows, again, it's still going up. It's just not going up as steeply, perhaps, as some of the people had worried about in the medical community earlier on. But a much more insightful bit of information comes in this. It's actually new cases by date. And so each day, Dr. Carroll is keeping up with how many people in Arkansas are testing positive for the coronavirus compared to the day before. Again, those numbers are not necessarily always counted. We're only counting total cumulative cases. And so this gives us an idea of the growth. Are we seeing more people get it every day or less? And generally speaking, unfortunately, you can see more. Most days are getting it than the day before. It's trickling up. In a stock market sense, it doesn't always just go up perfectly every day. Some days it goes down a little bit, but then it bounces back up. And so you can see the clear curve is just similar to the number we the growth we showed you a moment ago. I'll show you that one more time because it almost overlays. I mean, you could see the same direction in as far as the growth. But you can also see yesterday's numbers, for example, were 69 compared to the prior day's 80. But still, a single day off doesn't necessarily mean we're going back down. We wish it was the case. And we will keep making sure that we link this up so everybody can kind of track along with it. If you want to see this, go to neareport.com. It's in our story this morning, or go to drpatrickcarroll.com and check out his updates every day. Thanks, everybody, for joining us today on NEA Report. We do appreciate it. We came at you early this morning because, of course, we've got a broadcast tonight exclusively for supporters. 99 cents a month, supporters get to access exclusive content, and tonight we're going to be talking about the local newspaper world. The landscape changed this week, some big changes, with the Jonesboro Sun cutting back to 5 days a week. That's a major change, and a lot of jobs are being disrupted because of that, too. We're going to be talking about that tonight on NEA Report in great detail. But thanks, everybody, for watching our broadcast today. Keep up with news on neareport.com all day long, and if you think we did an okay job, a like or even a share would mean a whole lot to us right now. Stan Morris reporting in Jonesboro. Stay safe and have a good weekend.